coronavirus-related issue. And of course, the Gambia government's efforts and the Ministry of Health efforts in the fight against COVID-19, of course, to make the Gambia COVID-free. It's another interesting episode. This topic is going to be on the ongoing COVID-19 vaccination. And of course, I have familiar faces in the panel this evening, and I will just want them to introduce themselves proper. Then we go into the topic for today, starting on my immediate right.
Thank you very much, Mr. Njai. My name is Omar Silla. I'm a lecturer at the Gambia College School of Public Health, and also part of the COVID-19 risk communication and community engagement team. As a volunteer effort towards the fighting COVID-19 in the country.
Exactly. On my immediate left.
Good evening. Thank you very much, Mr. Njai. My name is Mbai Njai. I also work at the expanded program on immunization under the Ministry of Health. I'm the senior surveillance officer, also responsible for the data management on COVID-19 vaccination as well.
Well, gentlemen, welcome to another episode of the COVID-19 talk show. And it's no surprise you have on the t-shirt of Mr. Mbai Njai, I got vaccinated already. Did you already have your vaccination? But of course, there are criteria to getting the vaccination. And this is all that we will be discussing on this platform. But nonetheless, we will just want to start with some few reminders that this started a couple of weeks ago. And the whole rationale, as I said, is to fight the COVID-19 out of this country, to make Gambia COVID-19 free. And as of now, Gambia is doing a lot of efforts in the prevention of COVID-19, and of course, sending out different messages. And this talk show, or this program, being rolled by the Ministry of Health in partnership with UNICEF and Global Fund, is meant to strengthen that fight. We've started with various thematic areas, from prevention to schools and protection of school children, and of course teachers. And we're moving ahead today to a very hot topic, which is the ongoing vaccination that the Ministry of Health has rolled out. And this is where I will just start with Mr. Silla to give us a brief synopsis of where the rollout stands as of now.
So thank you very much. That's a very interesting question. I know that we all know that the world is racing for the herd immunity. I mean, that is to say we want to make sure that a good proportion of the community are vaccinated against COVID-19, so that the very few that might not have the chance of getting vaccinated could be protected. So I'm sure Mr. My senior will reveal some of the figures, but I'm so proud to also reveal before him that within a period of 1 week, I think the Gambia the coverage for vaccinations stands somewhere around 5,000 plus.
Wow.
So that tells you from the 19th to the 25th, 26th, about 5,300 plus people have been vaccinated against the COVID-19, the AstraZeneca COVID-19 vaccine. I mean, if this trend continues, mathematically what we are seeing is a very good coverage, because the interest is to ensure that, people have their first shots. About 15,000 doses must go before the next cycle of the second shot. So this 5,000 is already gone. So we have 10,000 more shots to say we're finishing the first cycle and head on to the second cycle. Because as at the moment, I know that we have some 30,000 plus shots available for individuals. So I think the messages are clear. I know that there are a lot of people behind who are waiting for somebody else to take the vaccine before they come out to take. That safety mind of saying, well, I have to see somebody take it first before I take it. Well, let me just wait for some time before I also take it. But I'm saying that about 5,000 Gambians have taken their shots. These are shots that are recorded. Maybe my senior will reveal that, because he's part of the, he's the head of
I think that's an interesting number, Mr. Njai. 5,000 have already been vaccinated, and the rollout has actually kick-started already. This is actually a huge number.
Yeah, thank you very much. It's a huge number, and then I think this was as of 25th of March, but as of today, as of the 28th of March, it has definitely increased. As a person responsible for the data on COVID-19 vaccination, so far we have vaccinated over the weekend. We vaccinated over 1,000 plus, and then it has definitely increased to 6,600 600 people vaccinated all over.
Excluding today.
Yeah, excluding today, and then today also, like there are lots of people vaccinated as well. So it's a very good. It shows that people are responding to our call, and then we encourage them to continue coming. We are definitely targeting specific populations, and then I think later on we'll talk about those target groups that we are definitely prioritizing. Yeah.
Now, you're talking about targeting specific groups. Before we go to the specific groups, I just want us to discuss about, of course, the prevention. In as much as we want to get these vaccines, we also want to, stay protected. What are some of the preventive measures that you would, want to remind myself, of course, and of course viewers watching out there?
So it's important to also send a clear message that taking the vaccine doesn't mean you're 100% safe.
Exactly.
I mean, the vaccine is there as a supplement to ensure that, example, if somebody had a COVID and you're vaccinated now, to ensure that maybe the next time you want to have the cycle of COVID, it's not going to exaggerate. And so people need to understand that taking the vaccine is not a passport to say that you're not going to be.
I am safe now.
I'm safe.
Exactly.
I wouldn't mind. So we still have to put a lot of emphasis on our non-pharmaceutical interventions. We need to have remind the general public on the usage of face masks, because it has been very much evident that the use of face mask, the hand washing, the physical distancing definitely slowed down the speed for the amplification of COVID-19, all over the world, including the Gambia. So we must continue, even with the vaccination. I keep saying that having the vaccine is part of the 100% package. You have to have the vaccine, but you have to ensure that the mask, the hand washing, the physical distancing is also prioritized as much as you're prioritizing the vaccine. So just to remind people that COVID-19 is still around, it's real, it's true, I mean, it's here. There are no signals that it is going anytime soon.
Exactly.
So we have to tighten up the belts, we have to continue fighting, we have to continue suppressing the virus, because that is what the virus needs. So we shouldn't allow the virus to, we shouldn't just suppress the virus to a level where we're going to lift and the virus jumps again. That is going to be detrimental for us as a country. So to keep suppressing the virus, what we must keep doing is ensure that we're having the face mask on when we go out to the public. Now I see a lot of Gambians are no more adhering to this face masks. And
in fact, this is where I was coming to, Mr. Silla. When COVID-19 started sometime around March last year in the Gambia, there were a lot of hype around it. People started taking precautions based on advice from the Ministry of Health as per recommendations of the WHO. We've seen institutions placing sanitizers at key locations, even at entry points of big institutions, major institutions, and taking these things very seriously. But as time went on, we saw a sudden decline in all these things. Are you actually calling for a reinforcement of these things again?
So that's interesting. When things like this happen, you give reference to health communication strategies.
Exactly.
So I think one of the strategies Gambia used that it was very effective is the fear-induced strategy. To communicate that, I mean, this is a very serious virus that is infecting people around the world, and we have to be very careful. So the hype was so high because, I mean, it was new, and the information, the number of deaths, and the number of everything coming around was just too much to bear. And we've seen that, like you said, in those days in the market, I mean, soaps and buckets were almost out of stock. So, but as time goes on, because the things, I mean, the speed for the transmission was slowed. People are not coming out of tests, so we are having very few numbers that were announced to be positive. So those are, I think people are so much attached to numbers also. So it's not only about seeing.
It's like the numbers determine their response.
Exactly. So when they see 5 new cases, they say like, okay, it's just 5. It wouldn't matter. So the next day when they see 30 new cases, it's like, oh, that's
they're on their mask
so
again.
somebody is changing his mind or her mind because of the number. So we need to understand that behind every number, that number is life. So, and we don't want to miss those lives. I mean, if it is 5, even if we're having 1 death, it means so much.
Matters a lot.
It matters a lot. That is what we want to prevent. So let's not be attached to numbers. Let us be part of the fight, not just looking at the numbers as in 5 or 30 or 100, and reinforcing your strategy yourself by the numbers. For me, we should start to see that the Gambia is 0 for everything. The active cases now stands at 200 plus. I mean, these are 200 and something people in our community that are positive for COVID. So we should stand together to ensure that everything gets to 0. So our campaign strategy now, the voice that we should speak as Gambians, is to ensure that we have 0 new cases, 0 deaths. Let's ensure that the figures that are coming are actually 0, and that is going to help the fight against COVID.
I think that's a positive ambition: 0 new cases and 0 deaths. That is very positive, and I hope and pray that Gambia becomes 0, 0, 0. Everything becomes 0. Viewers and listeners out there, the number to call is 945-7990. This is a live phone-in talk show, and we'll be discussing about COVID-19 and COVID-19 related issues only on this platform. If you have questions or want to raise some concerns, you can call that number 945-7990. 945-7990. Mr. Njai, the vaccination has kick-started. You've talked about almost 5,000 plus numbers as of the 25th March, and the numbers keep, coming up. But then, is it open to everybody?
No, it's not open to everybody. As because there, at the initial stage, we developed what we call national deployment plan.
Exactly.
And then before that, during that process also, we had to prioritize the population. And then the population that we prioritized first were the health workers. So all health workers across the country, both public and private, are part of the priority groups that will be vaccinated during the starting of this campaign. And then in addition to the health workers, we also vaccinating people with pre-existing health conditions. And also people that are 65 years and above. So these are the three priority groups that we are definitely prioritizing for now to make sure that they get vaccinated, because they are the most vulnerable group when it comes to COVID-19 disease. So these are the priority groups that we definitely vaccinating as of now.
Good. Now, when we speak about health workers, that means the frontline health workers who are in the hospitals and who are directly working in hospitals and hospital health-related activities. Who do you define as health worker here?
A health worker is defined as anybody who works in the healthcare system, like being from the they have different levels of vulnerabilities, but we just trying to make sure that because the number is not that much in the country. It's just about 10,000 health workers across the country, both administrative and also other cadres, starting from a cleaner in a health facility to the
That is why I asked, because this is very important. It's not only about the doctor and the nurse, but this is a chain.
So everybody, cleaners, drivers, and everybody working in the healthcare system is definitely a health worker as for the vaccination program, and we are definitely targeting all of them.
Now and then, the most important question here: are people coming out?
Yes, people are coming out, and then we are even sending people away, because some people that are coming are not part of the priority groups.
Okay.
And then definitely we want to give chance to the priority groups first. Prioritize ones like the first three priority groups that I first talked about. That is the health workers, the people with pre-existing health condition, and those 65 and above. So if you are part of this priority group, we definitely advise that you come over to the health facilities and also to the vaccination sites, and then the vaccinators will definitely enroll you and vaccinate you accordingly. But if you are outside this target population, this target priority groups, then you definitely urge you to stay calm. Your turn will come. We're just trying to say that because of the limited number of doses we have, we're just trying to maximize the number of doses to vaccinate those that are very, very vulnerable to COVID-19. That's why we're targeting these groups.
Good. And I wanted to ask this: are these guidelines actually being followed at the vaccination centers? Are you following as per what we have set as far as guidelines are concerned?
Yes, guidelines are being followed. And we're definitely trying to, because sometimes also as Gambia, you know that people will definitely come I know you, and then you say that boy, can you please help me? So sometimes those things come up, but we definitely strictly ensuring that we do not go outside this target these priority groups, because the vaccines are not many.
Exactly.
The number of doses, and then we have, for example, during our planning, we realized that about 300,000 people are existing here in the Gambia with pre-existing health conditions. And then we only have about 51,000 doses as we speak.
Okay.
So, and then health workers are 10,000 to 12,000 health workers. And then you also come into to people 65 years and above. According to the GIBO statistic, it's about 77,000 people. So you see that we have not yet, even if all of them come out,
exactly,
they will exhaust the doses that we have, and then there will not be even a balance for the second dose. So that's why we are very, very careful and trying to make sure that even though we're trying to call people to come out, we're definitely trying to be cautious enough to make sure that if the second dose is due, okay, those who took the first dose will have the doses that will be able to give them their second dose.
That is what was going to actually be my next question. We've talked about almost 5,000 and the numbers keep going, plus vaccination being rolled out. So far, how many doses are available? Because you're calling out for the general public to come out. Are there limitations in terms of numbers?
Yeah, so far we have 51,000 doses in country. We received 36,000 from the COVAX facility, and then we receive also through MTN South Africa, through the AU,
Okay.
we receive additional 15,000 doses. So adding up to 51,000 as we speak.
Okay.
And then due to the some restrictions in the EU and
Yes.
also India, where some of our vaccines are coming from, we anticipating some delay in getting some of the
Of course.
some of the additional
course.
doses that we definitely expect to receive. We expected to receive some next month, but unfortunately because of these delays, we're definitely going to have some challenges in that. That's why at the initial stage we said let's exhaust the whole 36,000,
Okay.
and then as we're anticipating for the second consignment to come maybe in April, before the second dose is due, we'll have those vaccines to give out. But as we speak now, we're definitely trying to be very, very careful
Exactly.
because we don't know exactly now,
Exactly.
because we've received communication from the COVAX facility to tell us that like they anticipate delays because of not even the EU's before EU's issues came in, the India where our vaccines come from, like Serum Institute of India, because they are partnering with Oxford University to AstraZeneca to produce the vaccines.
Okay.
So they also, like, because of the surge in cases in India, so they're also trying to also stop exportation, so that they
Wow.
also have they vaccinate their population
First.
yes, before they vaccinate outside. So that's the challenge we definitely having, and then we definitely anticipate this to cause some delays.
Yeah, I think it's important that generally, as a family, the Ministry of Health is part of a bigger family, which is the Gambia, to be able to understand these challenges, that they exist, like they exist in other countries also. Mr. Silla, I'm sure this vaccination campaign also comes with challenges. What are some of the challenges that came out since the onset?
So that's a good one. You know, because some of the time I am in the call center at 10:25. So you have some people that are calling. I mean, stressing that they really want to take this vaccine, and they are not part of the priority groups. To some, they want to take it because they want to travel, and they are taking it to be part of the criteria, because you know, that's the expectation that
Exactly.
this very soon it's going to be a part of the criteria for any international travel. So we had that pressure on the communities, people, you know, pushing so hard to come and get shots. So, but we have the other problem is, you know, we would expect that, of course, the few people that do not believe this vaccine.
Totally.
Totally. So they wanted to, you know, there is hesitancy. I mean, vaccine hesitancy is expected, but that's our responsibility to keep talking to people, to tell them that it is safe, and inspire them to come forward and take the vaccines. So we have people who also call and, you know, feel say a lot of things about the vaccine and that its politics and all that. But we try to talk to them, we try to convince them. And I mean, this is not about politics. Health is beyond politics. I mean, this is public health. But right now, it's public health and public health matters. So we have some of those challenges. And I think the other issue that perhaps we will have as a challenge, if because I mean, thank God, I mean, Mr. Bai is here, is to be very careful with our first cycle, not to be too excited to give the entire shots when we cannot secure for the next shots.
Extra shots,
In India, there's a trouble, and we know that the AstraZeneca, the first shot is taking up to 62 to 63%.
Okay.
So we need to have the second shots come so that the efficacy of the vaccine can jump up to somewhere around 70.
Minor things that I faced were fever. Sometimes you have fever. Okay, sometimes you have headache. At the injection site also, if you are unfortunate to meet with somebody whose hand is not heavy, you have some heavy, some tenderness at the injection site and all those things. Anyway, the person who injected me, I did not feel that anyway. So I was lucky. So those are some of the minor signs of side effects that will definitely come up, and then also sometimes fever, vomiting, and all those things. And then you by taking analgesics like paracetamol, it can definitely take care of them. And then if they exaggerate, like they do not go for a long period of time and then get severe, then you definitely need to report to the nearest health facility and also call 1025 as well to they will be able to direct you whatever to do next.
Good. I think that is important. The number that you can always call and inquire about issues related to COVID at the Ministry of Health is 1025. The number has been there, I think, since sometime way back in March last year. And the line is always active 24/7. But Mr. Silla, another important thing is vaccination. I think this is not the first time people are taking vaccinations. From childhood up till now, vaccination have been continuous. Why do you think people have reasons to doubt it this time around?
So that's another interesting question. I just hope you are a teacher someday. Yeah, I mean, you know, the case of COVID is a special case. If you understand the history of where COVID started, because I know, in fact, when COVID started, I was in Wuhan. So
that's the epicenter.
That's the epicenter of the virus. So why are people doubting now? I mean, people have doubted this vaccine. It's not just with COVID. I remember sometime some companies, some NIDs, that is the National Immunization Days, when it happens in the country, you go to certain communities, they will tell you, they will be hesitant to allow you to come into their communities. But for the case of COVID, it's a special case, just like Mr. Mayam said, because the process, to many believe that the process has been expedited. And so they base their arguments on the fact that we know that the routine time that he needs to take a vaccine would be somewhere around 18 months for the vaccine to complete its clinical trials. So
Mr. Silla, I'll just get back to you. I think we have a caller on the line. Hello, caller. Hello, caller.
Hello?
Hello, caller.
Hello?
Hello, you are online.
Yes, number.
Fine, thank you.
Benat.
Fine, thank you.
Okay, Unko.
Yang kay moy le?
Okay. Alla programo bidadal. Alla programo bidadal.
Ha, ang kay moy le?
Okay, but kay atel janal de borol ko penkela molla yata kende abundalo al timbula lawlo ma comme molla tardlalu. Eno man senia tardal mun man senia ani ka dumuro ko nyaadile ani ka bur nyaadilo bi admante wolo katala sol kunani taji ko kata itaje molla jat kende al talon no.
Okay.
Okay, banal mo ke kay nal ka tong ni man kende are kay na lo tano dam ko ni man kende ta lo tano italon no la.
Okay.
Ita sol kono.
Okay. Abaraka Bake, Mr. Jai, I think you can come into that.
Okay. Yeah, thank you very much, that caller. Maybe I cannot speak Maniga. Maybe
Silla can come into that. But I just want to remind you, these programs and topics are in phases. Today we are here speaking English. Tomorrow we'll be coming with the same topic, the same version in Mandinka. Day after we'll also be coming about with the same topic and the same version in Wolof. So feel free to call us in any of these languages. But nonetheless, we will handle this question.
Yeah. So I think he's putting emphasis on the issue of environmental sanitation.
Yeah.
That
I think you can speak in Mandinka if necessary.
Kababe bim fokan rongo kulti mi alon kulebe danding na dandang la senyal anding fodo tanul da senya fanang wala mong atela sulo di kajo ko janembes diamula borol la koto wala ka mo ngal tanul to e kata damil yolto nyanta senyal le senyal du ngamira anyelo commencer la sulo fango kono la
Exactly.
mata bari ni be suwo kono la sasa dul biji tuma do ite usoro taro ibo usoro suwo kono woto ni sasa ka bo suwo kono kanana tano to woto pour jato e kende a senia o nyanta commencer la suwo fon ko ibe korda min kono fongo e nyanta mek solo woto senia tade ibe dan daw min fanana e nyanta su a nyanta suula la ka je ko dan daw fanan senia ta tuma do ni woto senia ta ngambre ni tar tanol to fanan al tanol fanan be senia la bal tanol to fanan mol soto jel nyanon ko ka fitarol kede wati ni batila woto ba fala ko to nya ngala ko momele senia akumate de bari ba fana hakilo blanda ko senia mun kulel melon ko nyanda commencer la souf mo la kono la nyandi nyandi beftala kata lutano to.
Good. I think the question was very important and it has been well tackled. We continue with
yeah. So on the issue of why people will doubt now, why there is hesitancy. So vaccines, I mean, any vaccine that is introduced newly will have some chunk of the population that will be hesitant to it. But like I said, the case of COVID-19 is a special case because, I mean, COVID-19, there's a lot of solidarity effort that is put into COVID-19. And we know that initially when it started, the hesitancy of COVID-19 was too much. I mean, so one thing that troubled the COVID-19 vaccines was the issue of politics that played its part.
Exactly.
The global politics that played its part. But thank God that WHO was very efficient in tackling that when they came with the global solidarity, where states will come together and to say that, okay, this is going to be the solution.
Exactly.
So throughout the world, hesitancy is expected. It's now a matter of the communication strategies. It's now a matter of the engagement that is needed to ensure that you talk to those people that are hesitant. You go and meet them and deal with these issues.
Sorry, Mr. Silla, we have another caller on the line. Hello, caller.
Hello, Kewa.
Yes.
Alnembara.
Nimbara.
Hey, Alnembara, Kewa.
Yanke moele?
Suro Banyari.
Alhamdulillah.
Hey, I mean for going in, I mean for Tonyalan. Yeah, I mean for Tonyalan, but. But then I just call me, but I'm going to call me for whatever you did.
Good. I think this is a repeated subject again as far as cleanliness is concerned. It's just a matter of reiterating.
Just to put more emphasis.
Yes.
I mean, health facilities have, cleaners. Health facilities are a place that are definitely safe for any patient that is coming. That is the interest of anybody working in the healthcare facility, and that's why we have the infection prevention and control strategies that are employed throughout the health facilities. And in fact, for the case of COVID-19, for example, that's why the ministry did very well to dual track the health system to ensure that we are caring for COVID-19 cases and suspects, and we are also caring for the routine care cases. I mean, to ensure that the environment is there for you to come and not suffer any nosocomial infection, that is hospital-acquired infection. So
I think just to answer his concern, we can just have it in Mandinka also.
Coming ala kumo kita mintu drong coming mimbo na diam ko ini for drong na jada kenda bunda dal to ala senia wala ada sula wala na kumanto ke ka fa ko drong ila talo tano to banko kan anyata tera senia rinne bari senia mun kulir mi alon ko hana mangil tano dama fonti nga fujan ko sul fon ko nyata ko masada wolto kay wek so ko na sul ko no senia bari mo kilo mi ka sul ko ne kala tano to woni tano nota fana kam to ko mun buta sul ko wala tano londi no tawa fanto nga fitar lapso to jele tano to mon ka kudol pitel mi alon ko wala ko mi ko kam fantan ko wala ga infection prevention and control ka joko ni mo nata nang tuma do tano to kana ke mudi mi alon ko asa sa sikano ko bol tano to la kata ni wata su ko no so le bu kulul mi alon ko jada kenya bunda do kula ministry of health yo londile oto ni tano mi alon ko tuma do ife je tara nori ne oto it's your responsibility eta e dia management ni ya fo ko if kulu jam mi alon kam nyinya ini wala tali ni diam tuma do bari eta fo mamira tano bebe tara nya banko kan wasa ka kudu mi alon ko
good. I think that is very important, and the caller and the previous caller are assured that some of these concerns will be well noted and addressed in subsequent health-related programs. But the focus of discussion this time around is on COVID-19 and ongoing vaccination campaign that is ongoing. We will do it today in English, and we'll also do it tomorrow in Mandinka, and of course on Wednesday in Wolof, to look at the ongoing vaccination campaign. What are some of the challenges? Who is supposed to get the vaccine? Have you already get your vaccine? This is what we are discussing in this program this evening. Mr. Njai, I was supposed to shift attention to people with pre-existing health conditions. Are they coming forward for the vaccination?
Some are coming forward. The way we expected it is a bit low anyway, because we thought that like health facilities will be inundated with lot of people with pre-existing health conditions. But maybe also the other thing is like because the other regions did not start the vaccination properly, and then some of them have definitely started a bit earlier last week, and then some have definitely all across the region country, everybody has started, but majority of them are targeting launching, and then they definitely having these regional governors to launch the vaccination exercise at the various regions. So maybe after that we'll see numbers coming up more. But what I just want to tell those with pre-existing conditions, if you are going to a vaccination site, please take along something that will show that like you have a pre-existing condition.
Medical record.
Yeah, a medical record like a prescription or whatever record that you have to show the vaccination team that you have a pre-existing health condition. Yeah.
Look, I think that is very, very, very important. But of course, people need to know where these vaccinations could be received. I think that is
very well in all public health facilities in the country, and some designated private facilities are all part of the list for this vaccine. So you want to take your shot, just get to the nearest public health facility. I mean, our people are there, and they'll give you the best shot that ever you will want.
They will give you the best shot that you will ever want. I think that is quite reassuring. Mr. Njai has got the vaccine. I'm not sure, Mr. Silla.
Oh, yes.
So I'm the only one who hasn't taken the shot. But let me tell you this. If I fit in the category, I will be the first to walk in and take the shot. But I'm not sure I fit the category. So I'll be patient enough to wait.
Yes, you'll be patient enough. I will give you time.
I'll be patient enough. A rule for one is a rule for all.
Perhaps you come to GRTS. I told Auntie Mama, we will come to GRTS and start with you. And
Exactly.
You'll be part of the
you'll be most welcome. And of course, not only GRTS, but across some media, fraternity. Our families, from Paradise TV to Star TV, to MTA TV to iAfrica TV, and all community radio stations listening to this program. Just being informed that we have few minutes to wrap up this program, but I wouldn't want to leave you out of the studio without giving some few parting remarks.
Yeah, my remarks would be like, let people believe in the vaccine. The vaccine is safe, and then let them go out to the respective health facilities to receive their vaccines. Because like it's safe, I've received it, and then also like every health worker is going to receive it, and then those with pre-existing health conditions, let them all go out to the health facilities and receive the vaccination.
Thank you very much.
So COVID-19 is true, COVID-19 is here. We still have to continue putting on the face mask, the physical distancing, to encourage people to be aware that the COVID is still in the communities and is looking for you to be a victim. So don't allow COVID-19 to make you a victim.
Don't allow COVID-19 to make you a victim. I'm your host, Momodu Njai. Till we come your way, another day, another time on the special program called the COVID-19 Talk Show. Have a pleasant evening. Wow.
Gambia may be the smallest country in Africa, but it will host the second largest gathering of world leaders in 2022. To successfully host the OIC Summit and put the Gambia on the global stage, the government of the Gambia set up OIC Gambia to mobilize resources for the implementation of key development and infrastructure projects on a scale never seen before. 20 new roads will be constructed across the country, and the Bertel Harding Highway will be expanded into a dual carriage highway of 2 lanes on each side from the airport to Sting Corner. All people in the Gambia deserve clean water and a constant flow of electricity. Therefore, an entirely new water system will be constructed, including new transmission and distribution networks to meet the increasing demand. In order to provide a more reliable supply of electricity, the OIC Gambia project will replace and double the capacity of the NAWEC transformers and overhead electric cables. We will equip the police with modern apparatus and technical training in an effort to keep the streets of the Gambia safe. By building the largest international conference center in the region, a 5-star hotel with state-of-the-art facilities, first-class mobility services, and improving the VVIP experience at the Banjul International Airport, OIC Gambia will position the Gambia as the leading conference destination in West Africa. With our partners in the tourism sector, we will reinforce the preeminent position of our nation, the Smiling Coast, as a go-to destination. The OIC Gambia will create strategic partnerships that calls for the involvement of local talent and businesses as a matter of requirement. In short, OIC Gambia projects will create jobs, boost commerce, accelerate growth, improve the urban outlook and lifestyles of many families across the Gambia. So let's support the OIC Gambia as it prepares us for one of the biggest global events. OIC Gambia, building today for a better tomorrow.
Are you looking for opportunities?